This video is about rotator cuff repair. The rotator cuff is a system of tendons that surrounds the shoulder. Those tendons keep the ball in place in the middle of the socket. With age, those tendons can degenerate. When the tendons degenerate, they can tear. Rotator cuff tears are extremely painful and can cause a great deal of pain in the shoulder, especially with reaching motions and especially at night. The tendons can also tear with trauma, like a car accident or a fall. When the rotator cuff tendons tear, often it's associated with pain, difficulty sleeping, difficulty using the arm in day-to-day function, and certainly difficulty using the arm with manual labor jobs like if you were a carpenter or electrician. Certainly if you have a tear and you're an athlete like a baseball player, that can cause a great deal of pain and difficulty doing the things you may enjoy doing. There's a variety of treatments available for rotator cuff tears. Oftentimes the initial treatment will be physical therapy and anti-inflammatory medications and a cortisone injection. If those things fail, you may consider a surgery to repair the tendon. That surgery is an arthroscopic surgery. It's an outpatient surgery. The way the surgery works is you take the tendon and repair it back down to the bone, but then the tendon has to heal to the bone, and that process is very slow. For the first 6 weeks, usually there's nothing more than use of a sling while we wait for the tendon to heal. Then physical therapy begins, but the tendon's not healed enough to begin strengthening the muscle until 3 months from surgery. It takes 6 months for the tendon to completely heal. Most of the time, rotator cuff repair surgery is successful, but not all of the time, and certainly it depends upon the nature of the patient and the nature of the tear. In addition, the biceps tendon runs through a little hole in the rotator cuff and is frequently also inflamed. If the biceps tendon is inflamed at the same time, that should be addressed at the same time, or you can have residual pain in the shoulder related to it. That's usually addressed by another procedure called a biceps tenodesis, in which the inflamed portion of the biceps tendon is removed and the tendon is fixed lower down.